Hey, what's up, guys? My name is Kelvin, and this past summer I had the pleasure of working on some AI and healthcare stuff. So I'm the co-founder of Guava, and what we're doing is we're making modular AI agents for automated medical billing. Healthcare and a lot of industries like healthcare are very like legal, education, government. They're very slow to adopt new technology. So hopefully, like right now we're trying to pave the way into healthcare, trying to make healthcare and other like hospitals and big healthcare institutions um, adopt and be more open to AI. So first off, what are we trying to tackle in medical billing? Right now, we're primarily focused on prior authorizations. Essentially, what that is a form that providers have to fill out for the patient and send to insurance payers so that these insurance payers will approve their patient of certain medical coverage, certain high cost specialty drugs, and the like. Without prior authorization approved, then the patient will not be able to get access to these drugs. So how are these like taken care of? How is these prior authorization forms taken care of right now? So right now, this is all done by hand by most healthcare institutions, by most hospitals. They usually have like a medical billing department. And essentially, there's three parts to this. There is the clinical criteria by the insurance payer. So like you could think of like any big insurance company. So Health First, Aetna, Anthem. These are just some examples. They all have their own criteria to see if a patient qualifies for a drug that they cover. Then after that, these medical billers have to research the actual patient's medical history and then determine if like they even qualify for that. And they usually have to make a case for the patient based on like past lab results or past medical history. And after all of that is done, they will have to actually fill out the actual prior authorization form. And that usually could take anywhere from 10 minutes to 3 hours, depending on if the form is actually really simple or straightforward, if they had coverage of this drug in the past, or if it's a completely new drug, they usually have to write something called a letter of medical necessity, which is a letter to the insurance payers detailing why the billing department thinks that a patient is qualified for the medical coverage. So once that's all of that's done, the billers will have to submit the prior authorization form and then monitor to see if it gets approved or not. And if this, God forbid, if the prior authorization form isn't approved, then they would have to, the insurance payer will notify the medical biller, and then the medical biller will have to appeal it. And to appeal it, they would essentially have to go through this entire process again. And usually, as I said before, this will take anywhere from like 10 minutes to like 3 hours. And you could kind of see how much time it can take. So what can like, yeah. So what exactly like do these medical bills have to review, right? So they have to review diagnosis and treatment alignment, patient benefits verification, like site of care approval necessity, and then the payer's preferred drug products. Sometimes they have alternatives that they want patients to use, and then of course a clinical criteria eligibility. So once that's done, they will have to review, extract the information, and submit it. And this is like essentially what these medical billers are looking for. And you can kind of see how complicated and complex this is, especially when like if it's like a new medical biller and they don't have much experience doing this. Obviously this can take a lot of time. And oftentimes, like according to the American Medical Association, they did a survey in 2024, and they reported that over 90% of providers actually report delays in patient care, or and and then 20% over 20% of these providers also report that um, a lot of these times these prior authorization forms lead to complete abandonment of the patient care. So we could kind of see there's a big bottleneck in actually getting these drugs to the patients. So what can we do here, right? So what we're creating at Guava is modular AI agents that do basically a lot of the heavy lifting for these medical billers, right? So starting with the coverage and benefits checks, Guava instantly checks and cross-checks coverage and payer formulas in real time. so that we don't have to actually flip screen by screen and then cross-validate, cross-check like whether a patient is actually qualified, right? Then after that, like we could surface like all the relevant clinical criteria, and then through semantic search across payer-specific documentation. Essentially, what that entails is like any information that a medical biller might need, they could just straight ask our agent, and then it will serve the clinical criteria, for example. Then, of course, like if the medical biller needs to draft a letter of medical necessity, the agent will be able to write that for the biller like immediately, so that they don't have to like write it themselves, right? And then after that, like once all this is done, all these pieces come together, and the biller could finally submit it. So of course, health like hospitals and other medical institutions, they're very slow to adopt these changes because of HICCUP compliance and other regulations that like that vendors will need because of a bunch of HIPAA regulations and other rules that they have to follow to ensure security in the data that they transfer. So here at Guava, what we're using is basically completely publicly available data. So all the clinical criteria, all the drug formularies, and etc. These are all available online, posted by the insurance payer. And anything else, like any other documents that may need to get authorization for, will be working with hospitals to do that. Yeah, so obviously, as I said before, filling out prior authorization forms by hand takes a really, really long time, right? And to even do that, these hospitals will have to hire a medical billing department to fill these forms out, right? And oftentimes, these medical billing departments don't have 100% success rate, which leads to a lot of unrecovered revenue for the hospital systems, right? So usually it costs like if we were to put numbers down for hospitals, usually, and I'm saying hospitals with like 500 plus um, chairs in an organization, we could save around like $500,000 to $2 million annually, right? And then with that, we could with the help of AI and with the help of our agents, we could reduce around 30 to 60% of would-be denials, right? And yeah, so of course, like we could have functionality to complete the entire prior authorization process for medical billers. However, we specifically divided up the work into a bunch of sub agents so that medical billers could check in real time whether the information that we are serving them is valid or not. So that's just like something else. So basically, like right now, we're primarily focused on medical billing for infusion departments. However, in the future, we do want to expand to pretty much all physician administered therapies. So pretty much like all specialties. And of course, like we want to ultimately make this hospital revenue cycle a lot faster, so that patients could get the care they need, and of course the access to drugs they need.
In this demo, I'll be showcasing Guava Medical's modular agent trained specifically to support infusion billing workflows. This agent is trained to interpret clinical criteria, payer policies, and authorization requirements, all while living outside a sensitive EHR or PHI. I'll walk us through a few sample queries to demonstrate its usage in a real-world context. Let's say I'm reviewing a referral and want to quickly validate diagnosis to drug alignment before submitting for authorization. The agent can interpret ICD-10 codes and confirm whether infliximab is considered clinically appropriate. This reduces back and forth for providers and avoids downstream denials. Next, I want to understand payer-specific formulary preferences. Here, I'm asking if Inflextra, a biosimilar to infliximab, is preferred on Aetna's formulary. Guava's agent taps into up-to-date payer documentation to determine whether a switch to the preferred agent is needed, saving time on step therapy appeals. Payers like Aetna often have sited care policies requiring infusion at home or in non-hospital settings. This question checks whether hospital-based administration of infliximab will be approved or if a lower cost site is required. Guava's agent flags this proactively, enabling us to advise on optimal treatment settings. Now, this is a good part. Let's simulate a full prior auth prep. I've got the payer, drug, diagnosis code, and prescribing provider's intent. The agent confirms eligibility, evaluates whether criteria are met, and outlines exactly what documentation needs to be submitted. This end-to-end support is what makes Guava a true AI coworker, not just a search tool. Across these queries, you've seen how Guava's Infusion agent supports benefit validation, tier checking, site of care logic, and prior auth readiness without needing PHI, and all without having to log into a payer portal. This is what real infusion billing automation looks like. After sitting in on real-life infusion workflows at major hospitals, we saw firsthand how billing specialists are constantly juggling a complex web of portals, PDFs, and documentation systems. In response, we developed a lightweight overlay that sits directly on top of their existing systems, serving as an always available support layer for infusion billing. This overlay eliminates the need to switch tabs or dig through payer websites by allowing users to ask natural language questions like drug coverage, site of care eligibility, or clinical criteria, and get instant, context-aware answers. It's designed to reduce friction, accelerate decision-making, and lighten the cognitive load on staff who already have way too much on their screen. And most importantly, just like everything else developed at Guava, it is completely outside of all sensitive information.
Great. So that's the demo. So initially, we had a web app as shown. Like that was like the primary thing that was demoed. However, like since we realized that like after like we watch some medical billers in action on their day to day, they have to like constantly surface up like PDFs, go into their file directory, seeing like which PDFs are valid, close the ones, open, close, open. So obviously, like having another tab there will be very annoying. So that's why we developed like a new like app, like an OS app, so that this could just follow them around wherever they go, so that they could just ask this assistant like, hey, like I have a patient that needs Tremfya. Can you like please tell me what the clinical criteria for this is? Or can you like, hey, let's say I want this PDF, like I need the clinical criteria for Tremfya. It will just straight up give it to them. So because of this, we decided like, hey, like ultimately we think that an OS app would be the best platform for our use case. Yeah. So we can take like any other questions. But if not, then thanks for letting us show Guava to you guys.